Good afternoon, Leslie.
Good afternoon, Doug.
How are you?
I'm doing pretty well today. How about yourself?
I'm doing great, thanks. And it's a privilege to be with you and to spend an hour talking about a very important topic, CEO-led innovation. Before we get into our topic today in detail, why don't you tell me a bit about your professional background and also give me an overview of SEPTA as an organization.
Sure. So I think there are a lot of ways that you can become a CEO of a transit agency, and they're all very unique. Mine is definitely a story that I don't think anyone else has come here that way, and so happy to share that with you. You know, when I was starting out, I knew that I enjoyed working with people, and I knew that I wanted to have a positive impact on quality of life issues as well as communities and help neighborhoods. And so I've done a variety of things, including getting a master's of regional planning, where I concentrated on air quality and water quality. Environmental issues are a big concern and interest of mine. So my first job out of grad school was at the EPA, where I worked in the air division. And I will say that is the first time that my paths crossed with air quality issues related to transportation. And also worked with stormwater issues and other flooding issues, which is also something that has continued to be part of my life here. After that, I worked for our City Planning Commission here in Philadelphia, as well as the Central Philadelphia Development Corporation, in helping businesses figure out ways to give their employees benefits that would also help and lead to cleaner air. And after that, I was a stay-at-home mom for 8 years, and that's something I used to never talk about. Yeah, and now I always bring it up when I give my background, because I think it's really important for people to know that you can be in and out of the workforce.
And you can do it all. You can have a full life and still
absolutely
at a major organization.
Absolutely, the right decisions that are right for you and your family at different times. And when I came back into the workforce, I wasn't really sure how I was going to do that, being out for 8 years, and where my specialty had been spatial analysis, data analysis. And while I'm aging myself, while I was a stay-at-home mom, there was something called the internet that came out, and computers came onto the scene in ways that they weren't while I was initially building my career. And so I interviewed, and I was very fortunate to find an environmental engineering firm that was interested in my talents, which I found out were not quite the technical talents that I thought I had, but they felt that my talent was describing technical issues to people that did not have a technical background. And so I have found that communication skills combined with technical knowledge can be very helpful. And they also had just won the largest transportation project in the Commonwealth of Pennsylvania, which was the last piece of I-95 connecting Maine to Florida. And it was right here in Pennsylvania in Bucks County. And so I was very lucky. They put me on that project right away. They sent me out into the communities to explain, you know, why they would see people in hazmat suits removing lead paint from certain structures, and what right-of-way issues were going on, and exactly how this piece of interstate was going to be built, and why the detours would be in certain places, and why they would see certain changes, how long it would take. And I realized that I really enjoyed working with those communities. And I got to work on other transportation projects. I went on then to join a civil engineering firm. But while I was a stay-at-home mom, I got involved in my community. And I started off with our township day. I ran the pony rides as well as the prize booth. And that's where I learned a lot of my political skills. And then I was asked to join the Park and Rec Board. I then joined the Planning Commission. And to my surprise, was asked to run for township supervisor in my township. And at the time, I was in the minority party, and the majority of residents were in another party. And I thought, well, this could be interesting, but nothing I ever had considered. Long story short, there's 5 township supervisors, 3 were up. and our ticket decided to run as a true team. And I think to our surprise, as well as to the townships, we all won. And so we became a new majority. I became the chair of that board, and I quickly learned that all the matters that really mattered to me were decided in those meetings. And I was embarrassed that I didn't know that before. So where parks were developed, how businesses, coordinated with the community, stormwater projects, infrastructure projects, where we preserved open space, all of the things that really added to my family's quality of life. And so I really loved that and loved being part of the community there. I went in front of our county commissioners to help preserve some open space. And I realized that there was a job called a county commissioner, and you got to do it during the day and actually get paid for it. And so that was very intriguing. And similar to the township run, we ran, and for the first time, we were the majority in the third largest county in Pennsylvania, and got to serve with two other county commissioners. We each had different interests, and mine were planning, economic development, and infrastructure. And they had different interests. They were interested in judicial reform. They were interested in public safety. They were interested in social services. Also having an interest in what I was interested in, but trusting me to lead on certain issues. And I trusted them to lead on certain issues, which I realize now is rare in government, to have such a functional relationship, right? And
increasingly rare.
Right. So I got to be county commissioner. Loved it. Surprisingly left my civil engineering firm to give it more time, because I truly enjoyed it and realized that, I felt I could make a real difference there. And at the time I met a businessman by the name of Tom Wolf, and he runs for governor. And he asked for more information on how we consolidated departments and saved money and moved toward a bridge bundling, infrastructure package, and what we did at the county level. And I was thrilled that when he won for governor, he was filling his cabinet, and I was asked to put my name in. I don't in any way want to make anyone think that that was a done deal. I did have to be interviewed and vetted, and there were a lot of other interesting candidates that would bring different things to that position. But when he had to decide who his Secretary of Transportation would be, I was thrilled that he asked me to join his cabinet. And so I got to be the first female PennDOT secretary here in the Commonwealth of Pennsylvania and lead the Department of Transportation, which I truly, truly enjoyed. Also, he asked, and I got to chair the Turnpike Commission, again, being the first female in that role. And while I was doing both of those jobs, I got to meet and work with the chairman of the SEPTA Board, who also happened to be a Turnpike commissioner. And we got to work on some, I would say, controversial as well as contentious issues together, both that dealt with litigation, that dealt with difficult workforce issues and union issues and infrastructure issues and funding issues. And after several years of working together, he asked if I'd be interested in putting my name in for CEO of SEPTA. And after
here you are.
Yeah, on what we could do together, I am thrilled to now be the 11th CEO and general manager of SEPTA. So I've had the honor of leading the 5th largest DOT in the country, and now I'm here at the 5th largest transit agency in the country. And so it's a unique view.
I'm wondering what you haven't done. Talk about a multifaceted career, if there ever was one. So tell us, in a nutshell, about SEPTA.
Sure.
Give us the essentials.
Yeah, no, absolutely. Well, I am the second female to lead SEPTA, and others have said, oh, you've always been the first. Do you mind being the second? To which I describe, I think RBG did a pretty good job, and she was the second female in the Supreme Court. So I think all is good. But, joking aside, I am thrilled to be leading our agency. We have approximately 9,300 employees, and we have a budget of just over $2 billion. And we have quite an expansive system. I would say that we have one of the best, if not the best, infrastructure of any transit system in the country. And I say that because back in the 80s, when all of the different agencies that make up SEPTA, so there were different trolley agencies, there were different subways that were purchased, several bus companies, a light rail company that is together what SEPTA is right now. There were two major railroad companies, and they did not meet, just like a lot of other legacy agencies. And I always bring up New York as an example to explain to people that you can get on a train in New York and you either end up at Grand Central Station or you end up at Penn Station. And it's not so easy to travel between the two. And it's not so easy to get to all parts of New York because of that separated rail system. Well, we had something similar here in the Philadelphia region, but in the 80s, they built a tunnel to connect what is now our Jefferson Station, used to be the Reading Terminal, to our suburban station. So now every one of our 13 regional rail lines, our commuter rail, you can get through the city. And it really adds to our system. Now, we don't get to run it as the best system in the country due to limited resources, due to all of the difficulties in consolidating so many different systems. You know, for instance, our subways, they don't even use the same rail car. They use different rail cars, different, you know, gauges of equipment that we look at. And so putting it all together, it can be difficult. But that's, you know, a quick look. Before the pandemic, we were carrying approximately 1 million trips a day. And now, you know, as of December of 2021, we're just about a little over 50% of our ridership.
Well, thanks for that background, Leslie. You are widely known nationally as an innovative Chief Executive Officer. And wearing what I think of as the Innovator-in-Chief hat, you've been spearheading what has to be considered an out-of-the-box innovation initiative called SCOPE. Tell us about SCOPE in a nutshell.
Sure. So first of all, SCOPE stands for Safety, Cleanliness, Ownership, Partnerships, and Engagement, spelling out SCOPE. It became very clear before the pandemic, as well as during the pandemic, that the challenges presented by the vulnerable population, those experiencing homelessness, drug addiction, mental health challenges, they were using our system as shelter, particularly during the pandemic, as different social services either had to reduce or completely stop their services because of COVID measures and safety issues. And we needed to figure out a way to compassionately, you know, and sensitively help those who were in crisis and using our system. But we also had to do it from a business level as well, because how people feel about safety, there's the physical safety, right? They want to know they're not going to be exposed to COVID on our system. So all of our enhanced cleaning, our air refreshing that we've seen in so many transit agencies is important. But it's also important for them to feel safe in that, you know, they don't have to step over anybody. They don't have to pass, you know, people who are addicted to drugs, you know, shooting heroin and some, you know, aggressive behaviors that come from people who are high and who are on the system. And so we knew that we had to do something, and we wanted to get people into treatment. We wanted to get them into transitional and possible stable housing. And we wanted to help. And we knew that we couldn't just move people from one station to another, from one platform to another. One of the things we're very proud of here in the large system that we have is all the access points. You know, we value accessibility, right? We value on being able to connect people to opportunities who are mobility challenged. And to do that, We have elevators, we have escalators, we have, ways that you can access stations from a variety of points. And because of that, anyone can access us. And so it's very easy to get into the system, and it's very easy to move around. And so just by moving people around was not going to be helpful. And so we put together a very thoughtful and meaningful program. It was based on, we had already had a co-responder model program that our transit police had been working on, where they had paired with social service experts, addiction specialists, and gone around. They had a handful of pairs. And so what we have done is expanded that program. And
now let me interject a question, if I might. Tell us a bit of the backstory. How did you decide to launch the development of scope? What happened? You've talked about we doing this and that, but what really got you committed to this idea and convinced you to spearhead this development?
Yeah, so look, I'll be very honest with you and everyone listening to this. I was quite overwhelmed. There have been many instances during this pandemic that have been very overwhelming. And this was one of them. It was heartbreaking, first of all, to see all these people in crisis in the region. And then it was, overwhelming to figure out, what could a transit agency do to really make a positive impact here? And we're good at getting places, people from point A to point B, but we're not so good about, finding housing and finding treatment and getting them, to where they need to be. And how could we, right? Those aren't things that we control. Now, SEPTA had a history. We had the Hub of Hope, where they do have a place where people seeking shelter can get showers, they can do their laundry, and it's actually connected to one of our stations right in Center City. And we work alongside Project Home. So we already had that set up, but we knew that we needed to do more. And by the way, that was one of the agencies that had to decrease their hours, as well as, reconfigure how many people they could help due to social distancing measures. And also not so easy to find volunteers, right? And people coming in and being able to help out with the services that they provided during the pandemic. And so not knowing how to solve this problem or even work on it in a positive manner, I really leaned back to my county commissioner experience, where I worked with social services, and I worked with behavioral health, and I worked with mental health organizations, and I worked with housing. So I was aware of those communities. I just had not, worked in the middle of them. I had always worked with them. And in trying to figure out a way forward, what I did is I promised myself that I was going to make 2 phone calls a day. And I wasn't sure who those 2 phone calls would be, but I knew that I couldn't figure it out myself. And so I started to call. I started with my friends at the state level. So I called the Secretary of Human Services when I worked at PennDOT. I called the Secretary of Health. I called the Secretary of the Department of Drug and Alcohol Prevention. And I said, here are our issues. What do I look for? And they then put me in touch with some county health professionals. And then I reached out to some of my Montgomery County connections as well. And I knew, I knew what, Habitat for Humanity, how they were working. I knew how Your Way Home was working, which helps people get the services that they need. And I just kept calling. And every time I was on a phone call where they said, does anyone have anything to add? Does anyone need, I spoke up. And I said, look, I'm not used to talking about a problem that I don't have a solution to. But I can tell you there's this overall large societal problem that impacts all of us. So when I was talking to businesses, when I was talking to the chambers, when I was talking to elected officials, I said, we got to figure out a better way to work together. SEPTA wants to be part of the solution, but we can't be the total solution. Not that we don't want to be, it's just not where our expertise is. And so we just started the conversation. And people started to give me moments on their agenda to talk about it, because they were also concerned. And after a few conversations, community members started reaching out to me. I had presidents of universities saying, how can our students help? How can our social work students help? How can our medical students help? How can our public policy students help? We had organizations that help with getting people into stable housing reach out and say, you know, hey, we work with people experiencing homelessness, and this is what we provide. How can we work with SEPTA? We had elected officials reach out to us. And so we appointed somebody here at SEPTA because it became overwhelming just to organize all those conversations. You know, I was talking to someone and they're like, thanks for making all these calls. And at one point I said, I hope it's helpful because I feel like I'm generating all of these conversations, but not sure, you know, we're capturing all the information. And so then we put a team together. It's led here at SEPTA by a gentleman by the name of Ken Divers. I didn't know it at the time. But he also has some pastoral work in his history, and he's just the perfect person. In addition to operational technical knowledge, in addition to a wonderful manager, and obviously always showing compassion and empathy. And so he is leading this very important work for us, and he has managed to reach out to every single person who called us. Every time there's a lead, every time there's a different partner, and he has figured out ways to make these productive partnerships. We have co-op students working with us now. We have medical students who during the first year of their curriculum are getting credit now for riding our system, for being part of a team, and for providing medical help. You know, people experiencing homelessness don't always, you know, the first conversation you have them, it's rare that they say, okay, we will take you up on that offer of shelter and treatment. You have to have several interactions with them. And so each time we have one of those interactions, one of those connections, one of those discussions, it's a beginning. And sometimes it takes dozens of them before someone is ready to take us up on an offer of treatment. And sometimes it's that initial conversation where they're not ready for any treatment, but a first-year medical student can see that, you know, maybe an ankle is swollen, maybe there's a cut that's not healing, maybe there's a discomfort, right? You know, sleeping on the streets can be very difficult on your body. And so maybe they can help in another way and gain some trust and start that conversation.
So SCOPE is a SEPTA run program.
Yes.
Correct.
True.
That mobilizes and coordinates a wide variety of services for vulnerable populations? Absolutely.
So not only is it what you just described in reaching out to a variety of partners, to a variety of counties, you know, I just want to remind everybody that SEPTA is a 5-county, our service area is 5 counties. And so when we work with, you know, county health departments, when we work with, you know, city agencies, we also have our 4 surrounding counties. And so each county has their own, you know, system that is set up. And so we work with nonprofits, we work with for-profits, we work with healthcare companies that specialize in recovery. I can name a few names. Some of them are, you know, operate in several states. People will know them. For instance, Marquee Parkside Recovery is one of our major partners here. We have some local organizations, One Day at a Time, Eagle Staffing. They're Philadelphia based. But we have to look at, you know, all different aspects. So parts of our system, in fact, a big part of our system, our 69th Street Terminal, which you can pretty much access every mode of our network, is in Delaware County. And so we work with our Health Navigators program, which are those first-year medical students that I mentioned. And that's where they truly help us to connect individuals with health and social services, transitional housing, treatment, and other wraparound services. We have Horizon House, which provides emergency housing and behavioral health services. We have a partnership with a variety of police departments. So Philadelphia, Norristown Police Department. We work with a group called Gaudenzia. They operate nonprofit drug and alcohol treatment centers, Your Way Home in Montgomery County, which helps us out there and getting people into the treatment they need. And then we also have the County Department of Human Services, as well as those around the Philadelphia International Airport, which is also, in Delaware County. And so there we coordinate, engage, connect, with the vulnerable population, letting them know where the services are for them. So it's a big program and a variety of partners. And that's why it was so overwhelming, because you can't just concentrate in one area for a system as large as ours,
Right.
and multi-county and regional outreach.
Well, this is obviously a passionate interest of yours. How much of your time have you spent on scope as chief executive?
Sure. So, look, in the beginning, when I was making those calls, obviously daily, was working on this and, trying to fit it in with all of the other things we were doing at the time, which was, getting PPE out to everybody and making sure that everybody who needed to be tested was tested, and answering all the other questions.
All those things.
And so, I can't say that there's really a day that goes by that I am not either thinking about how we can improve this program, or I'm well aware of it. I use the system on a daily basis. Where I live, I can take the subway or the bus, which both of them are very convenient for me to get to work. And, I'm looking around and I'm seeing, what's happening in this region. And even when I walk around our offices, I see people experiencing homelessness, and, it's a tough time right now as we're seeing those numbers increase. But as far as, now that we have, one person here at SEPTA who is truly overseeing the entire coordination, I mean, the administration of it, the operations of it, the training of it, and figuring out how we can improve every day. All of those responsibilities have been delegated. And so,
and this is Ken. Ken is.
Yeah, and that's Ken Divers. So all of those, responsibilities, and making sure, again, it's a constant tweaking. How can we make this better and more effective? Ken is really doing a wonderful job, as well as we have a particular consultant who's helping us. I'm going to mention her name because many will know her, and that's Flora Castillo of Pivot Strategies. And so the two of them help get others on board, help get the message out, make sure that it's a, cross-county effort, and make sure that, as we hear different concerns and other areas that this effort can help, they help expand it. And expansion's a big part of it.
Are you aware of any other transit authorities that have launched comparable programs?
So there are other programs, and when I was making those calls, I did call other transit agencies. So I reached out to LA Metro, I reached out to BART in San Francisco, I reached out to Chicago, to colleagues in Boston, and others that I knew were having challenges. And I would say probably, I would not be surprised if every metropolitan area, I mean, this is a very common issue that many transit agencies are facing, many cities, many mayors are facing right now. And just wanted to see, what is it that they were doing about it? And of course, throughout the pandemic and the last 2 years as well, policing has gotten a lot of attention as well, pros and cons, right? And whether you want to lean toward a model that is heavily depending on policing, or whether you want to move away from a law enforcement model. And there's a lot of different opinions over what is the best way to do this. And so we wanted to, see what others were doing. We feel strongly here at SEPTA that it has to be a combined effort, that law enforcement needs to be involved. And we also know that we need addiction experts and mental health experts and medical experts. And So we've put together some good teams, and Ken and Flora right now are working on a team of 6, which one police officer or one law enforcement official out of that team of 6. And then the others are experts in what I just mentioned, in mental health and addiction, maybe in, getting to social work and case management. And we'll see how that works. And then we will adjust the size of the team to see what's working. One very interesting outcome that I'd like to add is when we brought on the medical students, we found out that the younger volunteers did not want to work with police. They had a very negative feeling about working with police. But what has come out of this is when I've gone out to see the teams and how they're working together, I see how well our law enforcement at the SEPTA Transit Police and these medical students are now working together, and they have wonderful relationships. And in fact, some of the medical students have shared with me that they have a different view now of how helpful law enforcement can be. And so we're thrilled to see that as well.
So did your board have any reservations? And tell us a bit about the SEPTA Board, if you would. But I assume you, to secure their support, spent a fair amount of time talking with them. And so tell us a bit about that dimension of this.
Yeah. So one thing I left out of my bio, which I shouldn't have, it was just, I was trying to get it all in. I was also a SEPTA board member. And so
what haven't you done? Plus being a stay-at-home mom, I think
well, I try to fit it all in,
So how do you manage not to sleep?
I am good at sleeping. I've always been very good at it. I'm very good at that. So that gives me a unique perspective. I believe I'm the first CEO, general manager here, who has also been a board member. And so I understand where the board questions will be. Not all of them, obviously. It's a different makeup of the board than when I served on it. And but I understand the information that's useful to them and that's helpful to them. Now I have several board members, and just to backtrack for a second, I have a 15-member board.
Okay.
And 4 of them come from this, I should say 5 of them come from the state. Some transit agencies have a heavy state board. We do not. So 1 is appointed by the governor, and then 4 are appointed by Republican and Democrat leadership, both at the Senate level and the House. So 2 appointees from the Senate, 2 appointees from the House on either at either party. That makes up the 5 from the state. And then the remaining 10 are from county elected officials. And so Philadelphia only has 2 seats, and it's the majority of our system, but they only get 2 votes. And so the counties have truly led SEPTA. And I remember one of the first public appearances I made as PennDOT secretary. I'm in a crowded room and I'm getting, transportation is not always such a friendly business, right? I'm getting pummeled by questions on why certain things aren't getting done. And they are yelling, and they are yelling about SEPTA, and they're yelling why SEPTA isn't doing certain things. And I happen to be, obviously I was appointed and served under a Democratic governor. So I am coming from a Democratic perspective, although I would definitely argue that transportation is completely bipartisan. And I was there with the head of our transportation committee, which was a leader in the Republican Party in Pennsylvania. And he leans over to me. He said, "Do you want to tell them, or should I tell them that SEPTA is a Republican majority board?" Because they were like calling on me on certain things. And I said, "Oh, I'll let you tell them." So it's something that is, not widely talked about, and people don't fully understand if they don't see it. So now we get to today, right? And so our board is now more 50-50, which it wasn't just, 7 years ago. And it still has a conservative business slant. And so they're very bottom line driven.
Well, there must have been some skepticism then about embarking on the scope
Well, right.
initiative,
That's why,
which
yeah.
is truly outside
Yes.
the normal transportation box, if you will. So did you experience any significant resistance, and how did you overcome it?
Right. So I wanted to give that background because it's hard to understand if you don't fully understand the background. And so it was very easy to make the business case here. And the business case is, how are we going to get our ridership back if people have to step over, people sheltering on our system,
Right.
along with discarded needles, along with human waste, along with unclean areas when people, sleep on your system. And so it made a lot of sense. And look, my board, they all have big hearts. They are all kind people. They all want to do the caring, solution to a problem. And so it was not very hard, to let them know that this was a big problem and that it was going to impact our bottom line, and that there was a sensitive way to go about dealing with this overwhelming and large societal challenge. And so it wasn't hard to get them on board. And they saw what was happening. They saw, for instance, we had to close down an elevator in a very heavily used station because the needles and human waste that had been jammed down into the elevator stopped the mechanism from working. The lift stopped working. And so in order for us to go in and see how we had to repair it, we had to actually close it, which made part of our system not accessible to, again, a very highly used station. And so it was starting to have a huge impact on our asset management and on how we maintained and kept up our state of good repair. So it truly was a business decision as well.
What were the preeminent concerns you had to address at the board level?
Right. So look, we get this comments a lot. Are we? One board member asked, we're not a social service.
Right.
We are. So some of them, we're a bus company, we're a rail company, right? We're a transit company. And while we are a transit company, we have the ability to truly help solve some larger challenges, and we should. And we are community partners, just as we support businesses in helping to get employees to their employers, and we help employers by making sure their employees and their customers can get to them. We also have this, greater role to play in helping this region that's coming out of a global pandemic. Some civil unrest, right? A lot of discussion on racial equity, which, by the way, impacts our employees and impacts our customers. Our employee makeup here at SEPTA, 67% of our employees are Black. And we have a high minority workforce. And the communities that we serve also have high minority populations. Philadelphia is the largest poorest city in the entire country. The need here is great. And so SEPTA provides a vital service. And we saw that during the pandemic as essential workers had to get to their jobs, and how people who were able to either work from home or stay home needed those essential workers to get to their jobs. Anyone who needed hospital care in the greater Philadelphia area needed SEPTA, because the many employees who clean those rooms, who provide food for the people who work, and the patients who would need to be getting services there, needed people to get there from SEPTA. When shelves were stocked, as we saw, so that people didn't have to worry about being able to get food during the pandemic. They needed SEPTA. So I always say, whether you actually needed to be on SEPTA or you needed services that were provided by people who needed SEPTA, you needed SEPTA during this pandemic, and you will continue to.
But you were able to make a strong business case for scope.
Absolutely. Look, we have to work on our ridership. It is, struggling and holding just at about, 50%. And in order for us to get our riders back, right, we need obviously those who need us. We want to continue servicing those riders. But in order for the greater Philadelphia region to function, in order for them to have a high level of economic development and economic health, the way that it is densely populated here in the greater Philadelphia area, you need SEPTA to function. Otherwise, it's gridlock, it's congestion. We've seen highway traffic fatalities. We've seen city traffic fatalities increase. And that also increases the costs, of supply for important products for everybody. If trucks can't drop off what they need to the businesses they support, we all pay that price. Congestion, is a costly factor for all of us. So we want to make sure that the trucks can get through and people can get through. And there really is no scenario that I have ever been presented with that doesn't allow metropolitan areas to function at the highest level, where you don't have a transit agency that can carry as many people as safely as possible throughout the day. You need them operating at their highest levels for metropolitan areas to thrive.
So you had, I assume, you've had unanimous support from the board?
I have. And we were given
wonderful
questions, which I appreciate. And so we knew all of their concerns up front. And then Ken and Flora have done a great job responding to all of those concerns.
Well, Leslie, you'll be happy to know that we've come to our last question. I know what kind of day you must lead day after day after day. So you'll be free of me in a couple of minutes. But as you look ahead, what do you see as the next steps for Scope in terms of development, program development? What's on the horizon?
Yeah, so those engagements, we're building on them. So we're a little over 6 months in. We've seen a lot of good progress, and every day we're looking to expand the program. We started it strongly in Philly, in Delaware County, in Montgomery County. As we expand out, we want to make sure that it also expands out appropriately to Bucks County, to Chester County. We get more partners on board, but we really do see the housing issue as being a huge challenge coming forward. And so we want to see how can we help, how can we help with that? And there are a variety of different models out there that we are exploring right now. And of course, funding is an issue. And
I was going to ask about funding.
Yeah. So obviously funding is always a big issue. And when we were discussing at the board level, we discussed the point of let's make this a 6-month to 1-year pilot that SEPTA will pay for. Because what was happening was by the time you get the grants through, and that's what I learned from all those phone calls that we made, it's not that the money's not available, but it just takes a long time to access and receive. And so we couldn't wait. And so we funded it for 1 year. And
out of the operating budget. So
Absolutely.
You're covering all of the administrative and coordinating cost.
Just like a lot of transit agencies, the federal money that's helping with operational costs, I feel like it gives us a short window, 18 months to 24 months here at SEPTA, to figure it out. We have a very short time to figure out how we are going to function in a sustainable way as we move through this pandemic. And there's no outlook that we've looked at that shows that federal funding lasts long enough for our ridership to come back at a very high level. Best case scenario has our ridership coming back at around 80% before the pandemic. And so we have to figure out, what is it that we need to change? What is it that we need to do to make sure that we can provide the service that this region needs with all of the changes that the pandemic has brought about? And so that's what I presented to the board, saying, let's figure this out over the next 6 to 12 months. If we can figure out what's working from all the conversations that I've had, by the way, at the state level and the federal level, people will fund this if they see that we're having a positive impact. And so now
that's the next, one of the next steps is not only diversifying into housing, but generating different funding streams, grants to cover the cost. But you see this still as a scope will continue to be a SEPTA initiative, a SEPTA program.
Absolutely, absolutely. And we are happy to share our experience with other agencies, and they can, pick and choose what works for them. They can copy it outright if that's what they want to do. They are more than welcome. We are all interested in helping people in crisis, and obviously also helping transit function the way that it needs to.
Well, Leslie, I want to thank you for spending an hour or so with me today talking about a fascinating out-of-the-box initiative. I think we have to have a part 2 down the pike and learn what you've done on the housing front, as well as resource development to keep this program going. And I guess you pretty well proved, though, that the model works, whatever fine tuning you need to do, right? You don't question.
We've gotten a lot of interest, and I'll just tell you one thing that we're really excited about is we'll be presenting at South by Southwest on government innovation. They're very interested in this idea, and that I think is an early sign of the interest in getting a national audience. And anyone who wants to help us, every time we speak, I am grateful that another organization will call us, because they see the issue and they know truly what the cost would be if we cannot, help this very, again, overwhelming societal issue that's impacting our area. And they want it to be moving in a positive direction. And so we'll continue to invite others to help us, because partnership is truly key.
We've got to have a part 2 down the pike.
I would love it. I would love it.
Let's stay in touch. And meanwhile, I wish you the happiest of holiday seasons. Stay well, stay healthy, and thanks again for taking so much time out of your schedule to tell us about Scope.
Sure. It was a great conversation. Thanks for inviting me.
Thank you, Leslie.